Hi, I'm student nurse Emily. If you hear an insanely loud noise, it's my dog panting on the floor. He just got done swimming. So today I'm going to be doing an IV start on my skills trainer. That's my other dog barking. This is a lovely environment. It's very peaceful, especially for an IV start. So I have my skills. I have a saline flush. I have a 20 gauge needle. I have my J-loop, and then I have my IV start kit. So the first thing that I'm gonna do is check my orders, make sure that this patient is needing an IV. Maybe their IV, something happened to it, they already previously had one and you're looking to start a new one, or maybe they're newly admitted. Whatever the case may be, most patients who are admitted into a hospital need an IV. So check my orders. I'm going to gather my supplies. I will go into my patient's room and I will wash my hands, introduce myself to the patient, screen for privacy, educate the patient on what I'm doing, which is just a simple IV start, and then raise the bed to a working height for myself. So the first thing that I'm going to do is check my patient's arms first and assess for a vein. So here is what I'm using, and I will feel around, say I find a vein right here. So I'm going to, it's a lot of fun listening to them bark. So the first thing that I'm going to do right now is get all of my skills ready. So I have a needle, and at this point I'm just going to get everything ready and make sure everything works. Attach what needs to be attached, so I can go ahead and attach my saline flush to my J-loop. Alright, I am going to check my needle and make sure that my catheter advances. This is a working needle. This is important because you don't want to stab your patient and then it not work. So that is that. I can put that back there. So I have a chlorhexidine swab, I have gauze, I have tape, and then I have a tegaderm. Alright, so I can't really do this on this patient, but I would tie my tourniquet. This tourniquet doesn't even really fit this box, but I would tie my tourniquet, find my vein. Okay, I'm going to go here, loosen my tourniquet. At this point, I'm going to clean the surface with my chlorhexidine swab, wait for that to dry. I'm going to re-tie my tourniquet. This is not easy to do. I don't even think I can do it with this. Yeah, it's not gonna stay. But in that sense, I can put it like this so that you know that I tied my tourniquet back. Okay. So I have everything ready at this point. I uncapped my needle. Oh, I would make sure that I had gloves on. These gloves are huge. I'm not going to attempt to do this with these gloves on because I could potentially mess up this skill. But I would have clean gloves on for this. So I'm going to pull back. This helps stabilize the vein when I'm going in. And so I'm going to go in at a 15-degree angle. And then once I get flashback, I'm going to drop the needle and progress a little bit further, and then I will push that catheter in. Alright, so catheter's in. I'm going to pop my tourniquet, apply pressure, and pull my needle out. Make sure you apply pressure because if not, your patient will start bleeding out. So here I have my J-loop, which it still has a cap on it. I didn't take that off. I would have taken that off. So here I have my J-loop, and all I'm going to do is attach this. Once it's on, I can grab the pink part of this needle. Alright, my J-loop is attached. I can flush this to make sure that it is a working vein. Make sure blood comes in and can be flushed out, and then I will flush it to clear it. And then I will take off my saline flush, and I will apply this tegaderm right here to my IV start. With this Tegaderm, I will put my date, time, initials, and the size of the needle that I use. So in this instance, it would be a 20 gauge. Once my Tegaderm's attached, I can J-loop this and I will tape it to whatever arm the patient is on. And then that's their IV.